So, hello everyone. My name is Joana Boakye, a practicing midwife who has worked for 19 years, and I'm an employee of Ghana Health Service, and my station is the General Hospital. My career goal is to be an icon that promotes maternal and child health. I currently render respectful evidence-based care to my clients. I also share knowledge and skills with my colleagues, and I also offer supportive supervision. Once upon a time in my facility, waking up in the morning to go to work comes with much anxiety and uncertainty. As a midwife on the labor ward, you enter the ward and the ward is packed to capacity, mothers sitting on benches, waiting in long queues to be seen. And all these women will be in various stages of labor. You'll be called to come and attend to a woman who is even convulsing in a queue. Some will even start bleeding while sitting in a queue to be seen. The numbers were more than the midwives. And this was very distressing to me and most of my colleagues. So one fateful day, General Hospital was visited by an NGO called Kipeli Incorporated. They recognized that there was delay in women receiving care upon arrival to the hospital. There was also poor documentation of client assessment findings. Also, there was no way of identifying seriously ill patients who needs help first. And so together with the General Hospital management team, they requested that the facility nominates 4 midwives who are dedicated, passionate about their work, and willing to work. I happen to be one of those who were selected. We were trained as champions, and we were tasked to also train all our colleagues in the obstetric team. And so the training was basically obstetric triaging to assess the client, prioritize the care. And so how we will be able to identify the seriously ill, color-coded bands. And so these bands will be put on the mother's rate. The colors we have red, which meant that this client needed urgent care. Color yellow means that the client needs attention, but some kind of delays is acceptable. And then color green means that it is the midwife who can manage this case. This case is a good case, is a normal case without any complications. They also helped us to come out with a structured tool for documenting assessment findings. And that is the triage assessment tool. There was also this beautiful tabletop game that gave midwives the opportunity to have scenarios of obstetric cases that we see. You select a case, that you read your scenario, you diagnose, and then you tell the color code that should go for that diagnosis. And that was very interesting. It brings that kind of teamwork and collaboration. So after the champions trained all the members in the obstetric team, we now had to educate our cherished clients, our pregnant women, to understand that anytime you are coming on admission, you will be assessed, and depending on the severity of your condition, you will be given a color-coded band on your wrist. And in our part of our country, Ghana, using the color red has its own significant meaning. It's a sign of danger. And so we needed to find innovative ways of letting the clients accept the color codes when they come. And so for the red color code, what we used to tell them is that if you are in a red color code, you are a superstar. You are the most important client for us. Anybody who enters the ward comes to you first and gives you care. And so this really helped our clients to really embrace this color-coded bands that we give to them. And as I speak, this intervention has really gone a long way to reduce the client's waiting time. It has better helped us to manage our bed capacity. After assessment, you are able to tell who needs admission, who doesn't need admission. And so the place is not crowded as before. And there is massive reduction in maternal mortality. That's at 2017. Our maternal mortality for that year was 37. And the rate was 688 per 100,000 live birth. The intervention came in 2018. As we speak, last year, 2023, our maternal mortalities were 5. And so the rate is 116 per 100,000 live birth. And these are some of the things that makes me so happy. You wake up in the morning, you are very sure of what you are going to do. There is a structured way of assessing your client, diagnosing their condition, and then giving them care. Having recognized the positive impact of obstetric triage on maternal outcomes, the Director General of Ghana Health Service, consented for Kimberly to scale up this all-important interventions in all high-volume facilities in all the regions in Ghana. I happen to be one of the national trainers, and the training has been ongoing since last year. I have enjoyed every bit of it, traveling on motorbikes and tricycles to get to how to reach areas to give training, giving the facility some basic equipment. As the trainers, we help the facility identify a place in their hospital where they will start the triaging, and we even help them to set up the unit. And all these are very, very instrumental in helping our mothers live. I strongly believe that midwives are strategically positioned such that if they have the right mindsets, the hearts and the hands, we will be able to realize a world free from preventable maternal mortalities. Thank you very much. And so that is my story for Obstetric Triage.